Okay, so in this video, what I want to do is explain the motions of the scapula or the shoulder blade so that you can visualize what's going on internally as we talk about the scapula and shoulder and as we start testing motions at the scapula and shoulder and MMTs. So this is his left scapula that we're visualizing, and the scapula can have motions that are planar. In other words, they kind of slide along a plane. They can also have rotational motions where they're rotating around an axis. The third option would be combination movements, and we'll get to those. They are not that confusing if we break them down into their components. So our first option is these planar motions. So the scapula can move up or down, and we call that elevation or depression. The scapula can move in towards the spine. We call that adduction, or out away from the spine, and we call that abduction or abduction. And then we can also have these rotational motions. The reason I'm grabbing this pen is I want you to visualize the axis of rotation for these. So if my axis of rotation is in superior and inferior direction and roughly lying about here, the scapula can rotate around that superior or inferior axis, and it can rotate in, we call that internal rotation, or it can rotate out, and we call that external rotation. We can also have a medial to lateral axis in which the scapula can tip or tilt backwards, we call that posterior tilt, tip or tilt forward, we call that anterior tilt, again, this medial lateral axis. And finally, we have one more axis of rotation, and this is roughly gonna be right here, kind of right below this scapular spine in this plane. And the scapula can rotate up, we call that upward rotation, or it can rotate down, we call that downward rotation, around this anterior posterior axis. Okay, so those are pretty straightforward. The other motions that you might be familiar reading about or learning about with the scapula are what we call protraction and retraction. So as the scapula sits, I know I have it kind of on his back this way so that we can utilize our cardinal planes, and that simplifies it. However, that's not really how the scapula sits in the body. It sits at an angle in the scapular plane. And as the scapula moves, it doesn't move in these very clean lines. What happens is, as the shoulder is elevated, or as the shoulder comes forward, the scapula is gonna move around the rib cage, and we call that motion protraction. So as you can see, protraction is a combination of abduction, a planar motion, and internal rotation, okay? Scapula can also move back around the rib cage, and as you can see, that retraction motion is a combination of adduction and external rotation. So hopefully that gets you going on scapular motions.